Even in the school-going children, we are seeing PCOS.
Early puberty. This is becoming very common in children.
People today are more anxious about conceiving.
A lot of women coming with is low AMH.
Preconceptional counseling.
Many women start hormonal contraception very early in life.
I have to applaud for the present day men because they themselves come up for the infertility evaluation.
Even our elders had stress. Even they had a lot of issues.
Severe male factor.
If periods are regular, can you assume that your ovulation is happening?
Between the ages of 37 to 40, they are coming up with the menopausal complaints, delayed marriages.
One lifestyle change with the fastest impact.
Weight loss.
Welcome to the very first episode of the Fertility podcast. Through this platform, we aim to bring expert-led conversations on fertility and women's health to help couples make informed, confident decisions in their journey toward parenthood. Today, we are honored to have Dr. Harshita Pradeep, MBBS, MS, OBG, DNB, an obstetrician and gynecologist, a certified infertility specialist, and a PCOS nutrition expert. As a doctor and a mother, she brings both strong medical expertise and real-life empathy to her patients. We are truly excited to have her with us. Welcome, ma'am.
Hi, happy to be here.
Before we begin, could you tell us about your journey, the kind of patients you're seeing lately in your clinic, and from your experience, what changes you're noticing in women and couples' health today compared to a few years ago?
Okay, myself Dr. Harshita Pradeep. I'm an obstetrician and gynecologist practicing in RR Nagar, Bangalore. So commonly what I'm dealing today is the high-risk obstetrics, the fertility problems, the menstrual disorders, and the surgeries I perform are mainly of fibroids, ovarian cysts, and certain fertility-related laparoscopic surgeries. So based on your question, in the last 5 years to recent only what we are seeing, the changes are very significant. Earlier, in the past 5 years ago, it was all the structural disorders which we were seeing. Either it can be uterus or tubes or a severe male factor. But currently it is of lifestyle and metabolic disorders. For example, if I can say it can be PCOS, obesity, endometriosis, the lifestyle changes disorders is the common one. And one more thing which I can tell is the delayed marriages. So people are planning their marriages after 35, planning their pregnancies much more later. So where the biology is already on the declining trend. That is one more thing. And I can tell people today are more anxious about conceiving. Then they are also getting more information, but I cannot tell it is a right one. It is a misinformation they are getting from the internet, from the social media. So the fertility disorders what we are seeing needs medical care, but it should be combined with lifestyle, hormonal and other things too. It reflects the overall health.
What are the biggest reason couples struggle to conceive today compared to previous generations?
Okay, this we can categorize into 5 pillars. The first thing is, which I already spoke about, the delayed childbearing. After the age of 30 in women, the fertility declines, and after 35, it significantly drops. So that is one major concern. Earlier, we were seeing epidemics of certain infectious diseases, but now PCOS has become a major epidemic. Even in the school-going children, we are seeing PCOS. That is a major burden, especially in urban areas. Then the third thing, severe male factor infertility. If we consider 100% infertile couples, out of them 50% their male issues are seen. It can be in the form of count reduction or the morphology or the motility disorders. Then the fourth one, the lifestyle change. Most of them are sedentary, like having processed foods, sleep deprivation, stress, all these are the major concerns. Then one more thing, metabolic disorders, mainly the obesity. So these are the 5 main things. If treated properly, the fertility issue can be sorted well.
Many women start hormonal contraception very early in life. So do you see any long-term impact of early or prolonged contraceptive use on fertility later?
This is a common question. Most of them come to us because recently married, they would use hormonal contraception for certain years so that they can have their private life. So I say it is a big no, because the hormonal contraception gives rest to the ovaries for certain time. The ovulation will be at a certain rest. That is all fine. But once after they stop using this hormonal contraception, the fertility is reversed. But one thing which we notice is that using these hormonal pills, that is the common one is the oral contraceptive pills, the PCOS and the disorders like endometriosis, adenomyosis, all these get masked. People think they are fine, but this one issue can be the one biggest burden for the delay in the diagnosis. Infertility becomes diagnosed later, but they blame it on OC pills. So this is not the one which they think is right.
Okay, adding to this, if they have to try contraception, what is the best thing you would suggest?
There is barrier method, the condoms which we normally tell. There are IUCDs, that the intrauterine contraceptive devices like copper T or something. I would not preferably suggest the injections like DMPA because it causes irregular cycles. It again make people think it is one of the causative factor for their infertility. So the one which I said earlier would be best for them.
So the next thing very important is early puberty. This is becoming very common in children. We are seeing puberty even from 8 years of age. So how does this affect hormone balance or fertility in the later years?
See, many of the school going children at the age of 8, 9 as you said, they are attaining the menarche very early. Earlier during our school going ages it was around 13, 14. So it has reduced in its age. The main problem is the children are more attracted towards the junk. So highly the unprocessed foods, and there is more chances of childhood obesity that is on rise. Then one more thing is the use of cosmetics. So parents knowingly or unknowingly they are using the cosmetics, especially the lipsticks on their kids. That is one of the risk factor. And one more thing which I stress on is the screen exposure. Most of the children are addicted to phones. These four major things are making them to attain menarche at the younger age group. This might be sounding very funny or something of not major concern, but this in next few years can turn into PCOS. At that age group, they will not have their regular cycles, in turn leading to infertility. So the one which begins at an earlier age needs to be corrected.
Most important question, after 35, what are the most important biological changes you see in women beyond egg count?
After the age of 35, it is not just the number of the eggs that reduce, it is the quality that reduces. That is one major factor. Then once it starts reducing in its quality, there is certain mutations, that is the chromosomal abnormalities begins. Even though if the woman conceives, the embryo quality will not be good. So that leads to miscarriages. That is one more thing. And at the same time, the age related disorders, it can be the gynec or the metabolic one. Gynec like fibroids, endometriosis, adenomyosis, this will begin to rise after the age of 35. And one more thing, after the age of 35, the metabolic disorders like hypertension, diabetic, thyroid disorders also will start peaking. So together all this contributes into infertility. It is not just the age, it is the overall medical disorders which will be affecting the fertility.
So is this also for men?
Yeah, it is the same for the men.
The next question which we see a lot of women coming with is low AMH.
Yeah.
So this creates a lot of fear.
Yeah.
And one observation what we have seen is at least the past 8-9 years before, we were not seeing people talking about low AMH more,
yeah.
but now they are talking a lot. Like
Yeah.
if we get 10 clients, 9 of them tell about low AMH.
Yeah.
So how is this related, and is it really a very important factor? So what is your take on this?
See, AMH, which stands for anti-Mullerian hormone. Okay. So basically the normal levels which we talk about is it should be within the range of 1.5 to 4. So if it is more than 4, again it is one of the sign which tells it can be PCOS. If it is less than 1.5, that is 1 to 1.5 is borderline, less than 1 is a low fertility. Okay. So this, I am very happy that people are aware about AMH. At the same time, it is causing the anxiousness in their minds, thinking that if I am having low AMH or high AMH, I have zero fertility chances. No, that is not correct. AMH tells only about the eggs number. It is not telling about the quality. Okay. So the AMH levels is majorly, like significantly important in case of IVF outcomes. it will not predict about the natural pregnancy. So better if you have good AMH values. Doesn't mean zero AMH is absolutely no fertility. So there are still chances of pregnancy.
So adding to this, is AMH not a naturally declining factor, or does it decline suddenly because of some reason?
No, there is no sudden drop. It is the gradual loss. As the age increases, the number of eggs starts reducing. See, which we normally say is at time of birth, we are expecting a woman to ovulate around 400 times. So actually, if we are telling if there are no issues in their menstrual disorders, 400 eggs will be released throughout her lifespan. So if she is having the low egg count in the beginning itself, or if she has attained menarche at the very younger age group which we are discussing now, or she is attaining menopause at a very early age, so the number of eggs are less. That suggests the AMH is low. So AMH drops at the age advances. There is no sudden drop, but what commonly we are seeing is the high AMH. The PCOS is on rise, so at the same time AMH is increasing. We are seeing patients with AMH 10, 12, 14 also.
So one more question again added to the AMH thing. So if there is low AMH, is IVF the only option?
No, I'll never tell IVF is the only option. There are conditions which IVF is a better option for them. Doesn't mean they are not conceive. I'm telling, though the number is less, the quality might be still good in whatever the remaining egg she has. The chances of natural conception is there. Better if she goes for IVF.
This question for men, I think we're seeing a lot of men coming now in this age group, 35 to 40. So what changes do you see now in their sperm quality compared to previous years, and this DNA integrity, miscarriage risk and all that? So can you throw some light on that?
One thing I have to applaud for the present day men, because they themselves come up for the infertility evaluation. That is very much in the recent trend. I'm very happy about it to share. So men today, they are contributing equally to infertility. As the age advances, with respect to the females, it is the same with males also. As the age advances, in the semen analysis, the sperm count reduces. The morphology, what we commonly see in the structure of the sperm, the head, middle piece and the tail, there can be abnormal head, bifid head, absent tail. That is one abnormal sperms which we are seeing. Or the motility disorders. The active motility is not seen. The progressive motility, what we commonly say, is getting reduced as the age advances. Then there is one more major thing which is neglected, is the DNA fragmentation, which is commonly a talk of the town presently. If the semen analysis report shows normozoospermia, what we tell, the number, morphology, motility, everything is fine. But still, why the couple are not conceiving? The major issue is with the sperm, that is the DNA fragmentation. The genetic material is getting disturbed there. So that is one which needs to be assessed. As the age advances, this DNA fragmentation, which is supposed to be less than 15%, which we tell is normal, if it is more than 40%, it significantly adds to the infertility, mainly the one which we tell it as unexplained infertility. So this should be considered seriously.
Today's work culture is very screen heavy and sedentary, especially in metropolitan cities. We are seeing a lot of this. Do you see a direct link between this lifestyle and fertility or hormone disruption?
A big yes to this. I can just in an easy way say that desk job is one which is causing infertility issues. Okay, people are stuck to their chair, which in turn leads to obesity, mainly the abdominal obesity, which leads to insulin resistance. In males, it reduces the sperm production because they work with the laptop mostly placed on their lap. So there is more heat exposure to the testicles, so which reduces the sperm production itself. In females, this insulin resistance indirectly is related to anovulation. They will not have their cycles regularly. So the sedentary lifestyle, though they are working, they consider it to be nothing, not much related to their fertility. It is a big correlation which is happening. I tell people to be fit, but due to some of the other issues, the sedentary lifestyle is affecting them a lot.
But in contrary, we are also seeing people like who are from rural areas also. Yeah. They are also having those issues, even though they are not on desk jobs, they're doing something else. So how is that related?
See, rural people at the same time are exposed to fertilizers,
Okay.
pesticides.
Right.
So they are working for longer time, but the one which are not supposed to be with the contact of them are getting like, though the skin barrier might be have lost somewhere else, the fertilizers will be entering. So this, though not in a significant amount, that affects fertility. And the village side, I can tell they are more towards the betel nut chewing
Okay.
and men towards the tobacco.
Right. Right.
So that is also affecting. It is
Yeah.
not just the weight.
Correct.
In case of urban people, this is the main
This
concern.
is the main concern.
Yeah.
And even alcohol.
Yeah,
impact,
that
right?
that has a significant relation with the infertility.
And screen time, I think even people rural or urban.
And now it is almost the same.
It is the same.
Yeah.
So everybody has problems with
They are stuck with the phones.
including children to adults.
Adults,
to old age,
everyone.
everybody
Yeah.
has phones. They're glued to it. So, from a doctor's perspective, how powerful is nutrition and lifestyle correction in improving fertility outcomes alongside medical treatment?
Okay. So I can tell, with weight loss of just 5 to 10%, the ovulation like booms.
Right.
Okay, so the whatever the ovary, the oocyte quality will be there, will improve. So weight loss is one very important factor. I can tell it is a combined one, that is the food, exercise, sleep. The three put together, if everything is fine, the fertility improves.
There's a lot of people now, because we all shop online, we see a lot of influence on social media. Everybody suggests a supplement, random supplement, and people buy it off the shelves and they take it telling this is improving their health. So are you seeing any side effects of that, and is it really recommended to take so many supplements? Is it needed?
See, I don't suggest supplements. I tell, eat a balanced food. The nutritious food is one which is very, very important. I tell people to reduce the intake of carbohydrates and increase proteins. That is one major factor. Supplements, they give results, they give advertisements, it is not the truth one. So better not to go for it, fall for such advertisements.
But I think our Indian diet is mostly carb heavy, right?
Yeah.
Too much carbs, morning, afternoon, night,
yeah.
only carbs.
People are into rice all 3 times.
Yes, only people who are like health conscious, they're going to the gym, they're concentrating on protein, I think. But other than that, right from kids to old age,
Yeah.
we are only dependent on carbs as a main source of energy. So I think that is also causing
Yeah.
weight gain and insulin resistance.
I would suggest the proteins, the best ones are the eggs, the seeds, nuts. Let them focus more on this, and along with that the green leafy vegetables. That is most important. People go behind protein supplements or some of the Ayurvedic medications. I am not denying regarding the Ayurveda supplements. I tell their effect on that is just hardly 1 to 5%. Rest 95% is still in our hands, which we are able to correct
If
it.
the diet and lifestyle is wrong, then nothing is
Nothing works well. Yeah.
Thank you so much. Okay, so for couples above 35, how do success rates differ between IUI, IVF and ICSI in real life?
See, IUI, IVF, ICSI. I will tell what exactly are these 3 terms. IUI is the semen, the process to semen will be there, where the good number of sperms with high motility and normal morphology would be selected as much as possible by centrifugation technique. That will be injected directly into the uterus, that is intrauterine insemination. Then there is IVF, where the oocyte and the sperm will be fertilized outside. Then it is the embryo is transferred inside, that is the in vitro fertilization. Then something called ICSI, that is intracytoplasmic sperm instillation. That is into the cytoplasm of the egg, the sperm is injected. So out of these 3, after the age of 35, I will tell ICSI is better, following IVF, and IUI the chances are just 10 to 12%, with IVF around 30 to 40%, with ICSI it is still higher. So I would suggest ICSI for them.
Okay. So adding to this question is, we have seen a lot of people who come to us telling we've done 10 IUIs, we've done 5 IVFs, but nothing is not working out. So why does this happen? Why does it fail? And is there any prep they have to do before going for an IUI or an IVF?
There is one common term which we use as gynecologists, something called preconceptional counseling.
Right.
That is, before planning their pregnancy, there are some adjustments or the corrections which need to be made by both of them, not just wife, it is both husband and wife, like weight loss of both of them, correct whatever existing disorders are there as much as possible, bring it to normal, like thyroid disorders, correct it. Either they can be hypothyroid or hyper. Then the weight loss, which we already said. Then the major thing which we have to concentrate is about their lifestyle. Tell them to be more fit. And then the stress-free environment is very much important. So it is not just the work stress, even the stress they are taking that we are not able to conceive is one that needs to be corrected. So all this, after that, the emotional well-being is also very much important. With this everything being normal, if they go for IVF, the chances would be better. And many people think, why should I lose my weight if I am going for IVF? Everything will be taken care. No, from the embryo quality, it has to go till 9 months. So that period is longer. Everything should stay fine. The only conception is not okay. During the pregnancy also, certain disorders like hypertension in pregnancy, diabetes in pregnancy, all these starts appearing because they are already quite elderly. So that needs to be corrected is what I feel. That increases the success of IVF.
Okay. So for what kind of couples do you usually advise IUI and IVF?
IUI, if the woman is ovulating, everything is fine. If the PCOS can be normally treated with ovulation induction, we suggest them the timed intercourse. We'll explain them the fertility window. In cases of IUI is one where the count is very less, or if there is any cervical factors in the women, like even though the intercourse is happening, the cervical mucus is one which is disturbing the sperm. So to overcome that, we will suggest IUI. IVF is one where the counts are too less, or there is aspermia or completely nil sperms or no semen at all in cases of males, and majorly the tubal factor. If there are completely blocked tubes, even though if I try IUI, there is no success. So it is better for them to go for IVF.
Okay, just remembering one question. Many people tell that doctors advise for a sperm donor or an egg donor. So is this a boon, or is this something people have to be scared of, or they can really try?
See, if the only possible way to have a kid is this, if it is a donor sperm or a donor oocyte, I will not tell them to go back. Do not deny that, because if the sperm is zero in the couple, like in a men, it is better to go for a donor sperm. They will not reveal the identity. Obviously, the chosen sperms would be of the best ones, like in the terms of motility, number, morphology, everything would be selected the better ones, and they will be screened for infectious diseases also. So it is not something to worry. I feel they can go for it. But one thing which we can tell is the chances of having anomalous kids, like the anomalous fetus, something like some mutations or some defects in the fetus, it is not supposed to be blamed on the donor.
Right.
Yeah.
Right. I think that is, I think with medical advancement, nobody can become infertile. Like they go without a kid. There are so many things they can do to get a child into this world, right?
No, there are very rare conditions also we see. In cases like women can have an absent uterus, something like MRKH syndrome. Okay, in that she will not have uterus, or the uterus would be very tiny that she cannot bear the child, or she might have undergone surgery for some ovarian tumor happened at an younger age. She might have developed cancer at an younger age, where she might have removed both ovaries, uterus tubes, everything would be gone. For that, there is still a hope that she can have a surrogate mother. If everything is going well with legal aspect, she can still have a kid. The last resort I would always suggest, if they are not able to conceive by any of the methods, I will tell adoption. Even a homeless kid can get parents, and the parents would also be satisfied having a kid.
It's just in our mind, right? So
it is just, people think of legacy. No, that is not the only term. It is the emotional bonding which we are sharing.
Thank you so much for that. We now see more metabolic issues, inflammation, cardiovascular risk, even in younger adults. So does this problems affect fertility or pregnancy safety?
Yeah, I would suggest yes, because one thing is the lifestyle which we already spoke about, the obesity, and currently the trend of the MI at an younger age group, that is myocardial infarction, which we commonly term it as heart attacks, are increasing. So people would be put on certain drugs or in certain conditions which we will directly suggest not to conceive also in few people. So this inflammation, stress, everything will increase the cortisol levels.
Right.
That
So,
affects fertility.
Yeah, one thing I want to know is, see, even in older generation, even our elders had stress. Even they had a lot of issues to handle. But I think they were not getting tested like how we are getting tested now. Like the health checkups and everything is becoming more common. People are more aware. And with that, they are finding out a lot of things about their health. Be it inflammation, they are testing for ESR or everything, HSCRP, everything in detail they're testing. Is this causing more stress for people?
It is a 50-50.
Right.
I can never tell it is not a risk or is it a risk, because being aware is a good thing.
Right.
See, certain disorders getting identified at a very initial level and seeking medical care for it is always the best, rather than being ignored. At the same time, I have seen in my clinic where if the normal range is written of something, if it is for CRP or something, if it is less than 10, if it is 11, people will be worried.
Yeah, correct.
So the stress will increase the cortisol levels, as I already said. In males, it reduces the sperm production itself. In females, it will affect on ovulation. So I tell better not to stress, whether it is related to their own health or related to fertility.
Right. So if men, for example, if they get to know that their sperm health is low, so what should they do to improve their sperm quality?
So being fit, healthy lifestyle, eating proper foods, no unprocessed ones, then reduce the use of gadgets. As much as possible, avoid keeping the laptops on their lap, not wearing the tight innerwears. Then one more thing, very, very important, is the one, get tested for the semen analysis, which you will be knowing. And even though if it is less, there are treatments, mainly the one which we suggest is the antioxidants, because the oxidative stress itself leads to the DNA fragmentation. So the antioxidants, which will be given for around 3 to 6 months. So there are treatment, people can go for it.
And many people also come to us asking about premature ejaculation, and they also ask if constant masturbation affects their sperm health. So I think you should tell if that really has an impact.
See, first thing is the frequent masturbation. It is not something to tell no for it. People can like men can go for it, there is no issue. Then prolonged abstinence, I can tell, leads to affecting the sperm quality. See, if there is premature ejaculation, one thing is the stress, or if they are on certain drugs, it is better to get evaluated. And one more thing, the psychological disorders. People are scared to meet a psychologist or a psychiatrist. So it is better if they go open up, like talk to them what is the disorder, and there are treatments for it. People can opt it.
Okay, does that help their condition?
Yeah, it will help. If not, there is still, we have chances of IUI or IVF.
Okay. So we are hearing more about early menopause and faster ovarian aging. So in your clinical experience, what ages are you currently seeing this happen?
Earlier, the days where our mothers or grandmothers, it was at the age of 47, 50 or sometimes 50 plus, they were attaining menopause. Nowadays, people are almost between the ages of 37 to 40, they are coming up with the menopausal complaints like hot flushes, palpitations, sudden sweating, or like a burning sensation in the urinary tract. These are all the common things which we are noticing. Like the way the early menarche is seen, early menopause is also on rise. This trend is not good. There are no corrections because it is an environmental influence. So this leads to an early ovarian aging. Early ovarian aging, if the woman is marrying late, like in the ages of around 35, so she has just only 3-4 years left for her to conceive. By that time, all her oocytes would have vanished. So the pregnancy would be a big challenge for her.
Okay, but this early menopause on their future health doesn't have a lot of impact.
Yeah, a big yes, because the menopause, as long as the uterus ovaries are functioning, the women's health is on track. Because once the menopause occurs, the ovaries, the production of estrogen, the E2 level starts dropping and the E1 starts increasing. This will further lead to the cholesterol level starts raising, which further increases the cardiovascular risk. The chances of MI start, the angina or the heart attacks increases. The bone starts getting weakened. There will be more chances of osteoporosis, the many other issues. She'll start forgetting things. The amnesia issue starts. So that is quite challenging.
I think 35 is still a very prime
Yeah,
in our life, right?
it is a prime working year, and we would have attained all these risks with us because of menopause.
And also we've seen people telling when you're menstruating, the risk of cancer is associated with women are less. And once they attain menopause, do they have those chances?
Yeah, certain cancers increases because of early menopause.
Okay.
So the ovarian cancers rise, the cervical cancers rise. So it is a big hurdle for us.
Is there any way to delay menopause?
No. It is not in our hands.
Okay, is there any medical support which...
Yeah, once she has attained menopause, there are hormone replacement therapies where artificially we give estrogens and progesterones.
Okay.
So even though if the women, in case if she has got both her ovaries removed because of many other reasons, due to some cancers or something, there are hormones which we can be supplemented from outside, but still there are many contraindications list, because there is certain list where we cannot give such hormones in them. If all these are ruled out in her, we can still give it. So we can correct the bone health, the MI risk. We cannot delay menopause, we can correct menopausal symptoms.
Okay.
Yeah.
And we've also seen people coming telling they have heavy bleeding, like prolonged bleeding during this time, and they take hormonal treatments and things like that. And it takes many years for that to subside and get into control. And after that, we see people telling because they can't bear that, they go for a hysterectomy, get their uterus removed completely. So we've seen that a lot of people telling that. Even in Bangalore, we're seeing that trend. So is this correct, what you're doing?
The people's misconception is that if I take out my uterus, the problem is solved. So this information in their head has to come out.
Correct.
That is not the right one. There are n number of treatments available, options available, and the last option would be surgery.
Okay.
If it is seriously indicated, the surgery, the doctors themselves would suggest on it. So there are hormonal treatments, the medical ones. Then they can go for uterine artery embolization if the contraindications are not there. They can go for hormonal IUCD, which we commonly tell it as Mirena insertion. All these are the treatment options available. The people are like so much biased about surgery that they themselves come up asking for surgery. I tell not to go for it directly.
They feel once it is removed,
all the issues are sorted.
But I think it starts only.
Yeah, they don't understand the seriousness.
Right,
yeah.
Right. Yeah, so we are done with the main questions. So we have rapid fire.
Okay.
So rapid fire for you. So 3 daily habits for fertility.
Food, exercise, sleep.
Enough.
Enough.
So what is the most ignored fertility test?
Sperm DNA fragmentation.
Okay. Biggest fertility myth today?
No menstrual problem, fertility is fine.
Okay. So that is a myth.
Yes.
Okay.
Even though periods are regular, doesn't always 100% assure us that fertility is fine.
If periods are regular, can you assume that your ovulation is happening?
It is one of the indicator, not always.
Okay. Even without ovulating, can there periods?
Yeah, it can happen.
Okay.
But not always. Everything has an exception, not always.
One lifestyle change with the fastest impact?
Weight loss.
Weight loss. Okay. So one message for our fertility couples for watching this podcast.
Don't delay awareness. So fertility is not just about conception, it is the future health.
So one last question which I'm going to ask. We are seeing a lot of kids who are born with health issues now compared to when we were kids.
Yeah.
Right? Especially neurological issues and autism and many other issues. Why is this happening? We are more educated now, we are more health conscious now. But compared to what we are seeing, I think in the olden days we used to see somebody somewhere telling that they have a issue with their brain development or something like that. But now we are seeing schools for kids with autism. So why is this number increasing?
See, the intrauterine which if we are talking, the mothers of this present generations are mostly the GDM ones, that is the gestational diabetes, or they might be diabetic before planning for pregnancy. The trend is little on higher side, and the thyroid disorders. These both will affect on the fetus. Okay, this is one which majorly leads to, especially the GDM or the overt diabetes, where the sugars are not under control, the HbA1c is at higher levels, that leads to any sort of anomalies in the fetus. You can, as we spoke about the neurological ones, the baby can have the spina bifida, the anencephaly, then the digestive tract disorders, then the heart related, many holes what we talk about, the ASD, VSD, PDA, many of these things. These are very common if the mother is diabetic or if she is over diabetic. And the autism, it is a developmental one. The parental care is reducing. So we are well educated, but our generation is more towards money oriented. We are running for the competition. So in that, at the same time, we are not giving enough time to our kids. We are giving all forms of whatever the resources are given to them, but the care, attention, like the way we were getting from our parents, they are not able to get it. They are stuck to the mobiles or the gadgets, whatever, video games, computers, all these things are there. The attention is lacking and the communication with them is reduced. We were reared up in we had our grandparents with us. But now it is just an isolated family. We live with only our parents, or we have our own kids. Only just two generations are living together. The interaction is less. So mainly the bonding or the emotional factor is not getting shared. That is the reason the autism, the ADHDs are all on the rise. So I suggest all my patients, not just conceiving, it is giving the adequate care, attention is also the most important one.
Okay, yeah. That is really good. But again, adding to that, finally, if the parents are really healthy, can they be sure that their child is going to be 100% healthy?
No, there is no assurance of it, because even a silent mutation we can't predict. So everything is fine. Many people come back to us asking, we are all fine, we have no health issues, why is this seen in our kid or within our fetus? No, it is not everything in our hands. We are able to correct 95% of the issues, still 5% is not in our hands. Okay, so I cannot tell it is 100% assurance.
Okay, if it's in our destiny.
Yeah, that no one can avoid it.
Right. But at least 95% effort has to be done by both the parents.
Yeah, that is must.
Okay. Yeah. So nice to be interacting with you, Doctor, on this. I think we had a very nice podcast. Again, a final note to everybody who's watching here. Medical treatments are so advanced that you can never be childless, you can never be infertile. But know what is the right approach. Definitely good nutrition, lifestyle, stress management, along with a good team of doctors will definitely help you in getting your baby. But be prepared for it, and we will see you in the next podcast.